következő English speaker, George Hayek. There is a country VGF projection like this, on visual acuity, reading speed, and ocular thickness in the patient.
So, ladies and gentlemen, people of the jury, thank you for being here. My name is George Hayek. I'm from the Department of Ophthalmology, and today I'll be speaking about the effects of anti-VEGF injections, incentives, on the visual acuity, the retinal thickness, and I'll be talking about the effects of anti-VEGF injections on visual acuity, the reading speed, and the retinal thickness in wet AMD patients. So what is AMD? AMD stands for age-related macular degeneration. It is the leading cause of blindness in individuals above 55 years old. And once people reach 75, the prevalence of this disease passes to 30%. It causes a slow deterioration of the macula. The macula is the central point of the retina, and it's the place of the sharp vision. It has a high prevalence in Caucasian females. There has been proof of genetic background, such as those genes, ABCR and PERI. And there is also environmental factors, such as smoking, low vitamin intake, and a high body mass index. I can qualify AMD. We can divide it in 3 stages: the early, the intermediate, and the late. In early AMD, from this picture, we can see some bruising. In the intermediate AMD, we can have more bruisings, these little yellow spots, and we have also pigment irregularity. As you can see here, those brownish spots. And then we have the late AMD. Late AMD can be divided in 2 parts. We can have ordinary dry AMD, which represents 85% of the total AMD, and the wet form. In dry AMD, we can see that there is atrophy of the photoreceptor. This is due to the accumulation of drusen, which will block the vascular, which will block the blood, the nourishment, and the blood supply of those receptors. This is why they will degenerate and then atrophy. Wet AMD is different. We have the vascular endothelial growth factor here, A, which is superior to the photoreceptor epithelial-derived factor. By this, I mean that we will have angiogenesis. So angiogenesis involves having new vessels. And who says new vessels means that the vessel is not mature. So there will be leakage. And this leakage is going to cause the accumulation of fluid subretinally and cause wet AMD. Now I'm going to talk about the functional diagnostic and the morphological diagnostic of this disease. So we have a chart. It's called the ETDRS chart. It's a simple chart with letters. The patient sits at a distance of 4 meters and has to recognize as much as he can letters. Then we have another chart, which is the Amsler grid. It is vertical lines with horizontal lines, and we have a black spot in the middle. So the patient has to focus on this monocular vision. And if the patient, while closing one eye and focuses on this little point, sees distortions or simply a blind spot, then there's a problem with the macula. This chart chart here is for long distance vision, and this chart here is for close vision analysis. Now, the main part of my research was the runner reading chart. Just to mention, Dr. Van is the person who brought this chart to Hungary. It is only 1 year old, and this is why we only have a couple of patients who we did this research on. So, what is the runner reading chart? It's a highly standardized, multilingual chart, which, as you can see, those sentences are not normal sentences. We are what we call octotypes. This means that you have, if you look one sentence to another, every sentence has 14 words in it. And was also taken in consideration while making this chart, the length of the word, the position of it, also the syntactical difficulty, and as well how many vowels and consonants were in every word. And this chart is actually specific to Hungarian language because if you translate those sentences to English, they will have a meaning, but they are not useful. Because every language needs to have its own standardized chart. Then, I will talk about the morphological diagnostic. We have two tools at our disposal. We have FLAP, which is fluorescent angiography. We inject the patient through a vein. We inject fluorescein, and then we use a special camera to follow the dispersal of this dye throughout the fundus. And this is useful to see if there is any edema or leakage in the vessels. Second is the OCT, optical coherence tomography. It is a device that will take different pictures of the retina and then reassemble them to obtain this image here with pseudo colors. And it can also give us a map of the retina so we can see the thickness in different areas. My research was done with 11 patients, 11 eyes. We had 9 females and 2 males. The average age was 77 years old. They were multi-treated with Lucentis, so for 3 months, and a retreatment was needed if they lost 5 letters or more with the previous ETDRS chart that I showed. Or simply, if when we did the OCT, we saw that there was an increase of 100 micrometer in retinal thickness. Prior to the injection, a full ophthalmological examination was conducted, also using the runner reading chart, and this was done before and 4 months after the first injection. And then the data was analyzed with a parity test. This is to show you how an injection is done. First of all, the patient has to be on the sterile condition. Then, by the use of a caliper, we measure 3 to 4 millimeters from the limbus to find the pastilla region. And then with a 30 gauge needle, we inject the product directly into the vitreous cavity. So I wanted to take a little time to show you patient number 7. Patient number 7 showed the most amazing evolution because before the injection, he could only read 62 letters. After injection, 73. As you can see in this OCT, the thickness here and here is not the same. Before, 356 micrometers. After injection, 152 micrometers. The reading speed, so patient 7 could read a sentence 26 seconds, in 26 seconds. After the injection, he could read it in 11 seconds. And in this reading chart, we saw that you had sentences from increasing size to lowering size. So, patient 7 could read 4 sentences. This means that he could only read the big ones. After injection, he could read 10, so he reached the level of the small character sentences. So, I will expose to you now my results. I have 6 graphs. All of them are in the same organization. In green, you have the before injection, and in yellow, you have the after injection. The horizontal axis is for patient 1, 2, 3, until 11. And the vertical axis, well, it depends on the slide. This one shows the visual acuity. So as you can see, before the injection, all of the patients could only read a couple of letters. After the injection, they have improved significantly, +6 as you can see here. Second result, the thickness. All of the patients, except patient number 10, showed an improvement in thickness. It decreased. And we passed from 240 to 257 micrometers. Now I'm going to talk about the number of read sentences. As you can see, all the patients could only read a couple of sentences. After the injection, they read more sentences. So we passed from 4 sentences to 7 sentences, an improvement of 3 sentences. Now the result number 4 is the reading speed. This is the main part. When you see those results here, you can notice that the average was 12 and then 8. By that I mean that the patient, before the injection, could read one sentence as 12 seconds per sentence. After the injection, it was 8. We did the same calculation, but in words per minute, and we obtained 74 words per minute, and then after injection, 100 words per minute. And finally, last but not least, we decided to compare the same sentence, but with 11 patients. So, sentence 1 was read at a speed of 16 per second, and after the injection, it was 9. And as you can see, all of the patients showed the same evolution. The average was 23 and then 12. Significant improvement. Conclusion. So, the BCVA, which is the best corrected visual acuity, increased from 61 to 67, and improvement of 6 points. The reading speed improved from 12 to 8. This means that the patient could read faster with sentences. The words read per minute also increased from 74 to 100. The retinal thickness decreased from 340 to 257 micrometers. Conclusion, or second conclusion, the radar reading chart has proven to be useful in describing the quality of closed vision, and it was very good for following the treatment efficiency in wet AMD patients. Our future goal would be to have more patients, not only those 11 patients, but also to analyze the quality of life. And I would like to thank you all for being here, and I would like to special thanks to Dr. Hayek, Dr. Grastyan, Dr. Produit, Diana, Camilla, and Dr. Grastyan from the Produit department. Thank you very much.
Thank you very much for your presentation. And I'm opening the discussion.
So during your presentation, you spoke several times about the thickness, the pathological thickness of the retina.
Yes.
So which range will you determine a non-pathological or normal you prefer thickness?
Okay, so I didn't
Wait a second, please.
Okay.
You have to speak into the language.
Thank you. So, in the presentation, I didn't talk about the normal thickness because I think it's too complicated to explain, but here. In the eye, you have, it depends where you measure the thickness. For example, you have the fovea. If you take around the fovea, the thickness would be around, the central part of the fovea would be around 100 to 120 micrometers. But if you take around the fovea, it can reach around 230 micrometers. And you also have the third part, which is the ora serrata, the upper part of the retina, which is even the thinnest, which can be like 100 micrometers. Thank you for the question.
More questions?
I would like to ask in what time does this injection last for? What time is it effective? And in what time did you measure these parameters after the injection?
Sorry, can you just repeat the first question, the first part? Make it sound like the first one.
Yes. What's the time which the injection is effective? Is it years, is it days, or?
Okay.
So how long do you think it's going to be effective?
We usually retreat patients. You usually retreat patients as you've seen. So if they have a decrease in the number of letters, so for example, let's say we have a patient. He comes, we diagnose him with AMD. What AMD, by the way? So we give the first injection. After that, we continue the treatment for 3 months, and then at the 4th month, we check him again. If the thickness is below, if it's below 215 micrometers, we do not give any more injection. We just follow him up. And just for the record, we have 220 patients in the pathological clinic who are under our care. Was it just the first question, or do you have another question? Thank you very much.
Okay, I have another question. Did you inject both eyes in this case, or just the one which is most effective or more effective? And how the reading was performed? The eye which is injected, is it similar or with both sides?
So the injection